Now, what does the NHI Bill actually mean, and what is it going to mean for each and every one of us as South Africans? Well, a friend of mine actually asked AI to explain in pop culture terms what the National Health Insurance Bill in South Africa means. So think of the NHI Bill as a Netflix subscription for South Africa. Just like Netflix provides a wide variety of access to shows and movies, NHI provides healthcare coverage for South Africans at an affordable monthly subscription. In other words, our tax and other contributions. An NHI subscription will entail that you get access to a wide range of healthcare services, include doctor's visits, hospital stays, medicines, and more. No more worrying about medical aid bills or choosing between treatment or financial ruin. And finally, the government acts as a service provider, ensuring everyone has access to quality healthcare.
Now you salary get 2,000. And I get a piece job, and I can get washing, get a laundry.
Now, here's my thoughts. It doesn't sound like a bad idea to have the private sector take on some of the load while the state builds capacity. That, in theory, that's a good idea, okay? But my concern with this is the private sector now has an unlimited amount of demand. Essentially, the private sector is going to have unlimited demand. Now, while this is happening, it is very important that the state builds public hospitals and builds up their capacity, because if they don't, the private sector, with all the influx that they're now getting, they can build more private healthcare facilities, and then they can become the main healthcare provider in the country.
Guys, I'm just reminded that today our president will be signing the National Health Insurance Bill at 2 o'clock. I'm just thinking about it, Banhaibo. What is the rush? Why are they rushing it? Why? Is it some election stunt? You know? And number one, guys, if this did not work in first world countries such as England and Belgium, like what miracle is it going to happen that it's going to work in a third world country?